Hi, I'm Kate Folb. I'm Director of Hollywood Health and Society, part of the USC Annenberg School for Communication and Journalism's Norman Lear Center. Welcome to tonight's discussion on older adults and caregiving in the age of COVID-19. Just for those of you who don't know who we are, quick commercial. Hollywood Health and Society is a free resource for TV and screenwriters to get accurate information and access to experts on anything to do with health and medicine, science, safety, and security. We are open for business. You can reach us. We're connecting writers even during this age of COVID-19. You can reach us through our website at hollywoodhealthandsociety.org, and we're happy to help. We're excited about tonight's discussion. Just a couple of housekeeping things. At the end of tonight's discussion, a survey will pop up, and we'd love for you to give us your input on how you felt the discussion went and other things that you might be interested in hearing about. The chat function will be disabled. We ask that you submit your questions through the Q&A at any time, and we will get to them either throughout the discussion or at the end of the discussion. We'll allow some special time for Q&A as well. That's all I'm going to say. I'm going to pass it on to one of our two co-moderators, former president of the Writers Guild East, Michael Winship.
Thank you very much. Thank you, Kate. Good evening to all of you who are watching this, and welcome. This is the fourth of a series of these discussions that we're having about the coronavirus pandemic and its impact on health and societal issues of concern to all of us. As Kate mentioned, this is being recorded, and after we finish tonight, it'll be available online in a day or two. So anybody can take a look. If you have friends you want to have take a look at it later on, they can see it and so forth. And as Kate also mentioned, if you have questions, put them into the Q&A, and we may tend to move them sort of toward the end, but if we see stuff as we go along that seems to work in the course of the discussion, we'll be happy to do that too. We passed a sad milestone today. We surpassed 1 million cases of COVID in the United States. According to the Washington Post, the count represents nearly 1/3 of the world's reported COVID-19 cases. It includes more than 57,000 deaths since February, although experts call those numbers an underestimation. We know that older Americans are more susceptible to the disease, and that long-term care facilities in particular have been hotspots. 1/5 of the nation's deaths from this have been in long-term care facilities. So I want to introduce our guests. Dr. Bruce Chernof is president and CEO of the SCAN Foundation, dedicated to creating a society where older adults can access health and supportive services of their choosing to meet their needs. Previously, Bruce served as Director and Chief Medical Officer for the Los Angeles County Department of Health Services, and as a Regional Medical Director for Medicaid and S-CHIP programs at HealthNet, which is a network model HMO. Kim McCoy-Wade is the Director of the California Department of Aging. She most recently served at the California Department of Social Services at the CalFresh and Nutrition as the CalFresh and Nutrition Branch Chief, where she led the expansion of CalFresh food benefits to older adults and people with disabilities, as well as several data and technology initiatives. She previously served as Executive Director of the California Association of Food Banks. So we are delighted to have both of you here tonight. I'd also like to introduce our co-moderator, Bo Williman, creator and executive producer of the series The First on Hulu and House of Cards on Netflix. And he is the president of the Writers Guild of America East. I'm going to throw it to Bo.
I'm always attempting to fill your shoes.
No.
And I am, and now I have the honor of being able to do that again for a moment as I launch us into the discussion here. I want to thank everyone that's shown up for this webinar. This is an incredibly important topic, and we wanted to make sure that we could bring you the most valuable and useful information on a practical level. Feel free to ask advice if you have specific questions regarding your own situation, but also be able to talk about this big picture, not only as citizens of the country, of the world, who must confront this this challenge collectively, but also as storytellers. The Writers Guild of America often teams up with Hollywood Health and Society to help give the storytellers of our society the tools they need to dramatize the world as it is, to reflect it accurately and responsibly. So that's one of our goals here. Also, please feel free to ask questions in terms of the way that older adults are portrayed in general, regardless of whether there's a pandemic, but also specific story questions you might have regarding the pandemic and older adults itself. So to kick things off, Kim, will you just give us a general lay of the land in terms of, I mean, everyone knows that older people are more vulnerable, but can you give us from an expert's point of view, what you're seeing, what we should know, and what we should be looking ahead to?
Yes, thank you so much for having us here today to talk about the tough time we're in as individuals and as families and as communities and as a Golden State and really the planet, but also the opportunities to see a new way forward and to tell new stories and invent a new world coming through and coming out of this. Right now, yes, older Californians are both bearing the brunt and are driving the success in driving the infection rate and the death rate down, in the sense that March 15th, older Californians were called to stay home and were the first to stay home and have been staying home the longest. So I really see older Californians as the heroes, just as the healthcare workers and our food workers and so many others. I think it's really important that we make sure we don't just talk about older Californians as vulnerable and at risk, which has a CDC language, a medical language, but also as leaders and heroes with a great sense of purpose serving us right now. But that said, yes, there's a medical risk that is quite serious. There is the risk of the communal settings that many older people live in, the skilled nursing facilities, residential, and there's a huge diversity in those, of course. But we all know, just like schools were sent home, conferences were canceled, baseball is canceled, it's better to have that distancing, and that's harder in communal spots. And then the third issue we're seeing, of course, is the social issues around racial disparities, economic disparities that can be really a triple whammy for older adults who have the medical risk, the social risk, and that congregate living risk. And that's why we're seeing not a disproportional rate of infection, right? Because older adults are staying home. A disproportionate rate of serious illness and death, particularly in these community facilities, particularly around elders of color. So it is a very hard time. And I think what's really hard about it is how uncertain it is and how uncertain the timing is. But I think we're getting more certainty it's going to be a while. Even as children may come back to school and restaurants may open up with different capacities, older adults are going to be, again, asked to stay home first and stay home the longest. And so that is enormously stressful for everybody. First and foremost for older adults, family, friends, trying to understand what this new world looks like. We at the state have been first focused on basic needs. Do you have your food? Do you have your medicine? Do you know who to call? Do you have your 5 friends, your 5 people to call who are calling you? We've been very focused on immediate basic needs. We now, second, are moving into the issues around loneliness and isolation, as people who in March may have had church and volunteering and grandchildren and travels and work, that fell away. And some of that's coming back and things like this. Thank you very much for going online with these forums. But many people are looking at a lot of time to fill without human connection, without human touch, without some of those core sources of meaning and purpose in their life. And we have to think hard about that, if that's going to be weeks and months of that. And that's why I'm so happy to be talking to the community of artists and creators who can help generate so much connection and meaning in life. And then I think the third thing, and we're too soon, we're not there yet, we're still in the middle. But I think, as our governor says, we're not going back, we're going forward to a new world. And I think that's particularly true for aging, where there's a chance to really leap forward and reimagine what an aging in community looks like, what residential facilities look like, what senior centers, which nobody likes that term anymore anyway, what is a community center of all ages look like? And so there's actually some opportunity to do some imagining here, which is hard to do in the middle of grief and fear and illness and death, but it is a ray of hope if we can think and imagine and co-create together. So I'll stop that but that's where we are in this challenging and fluid moment.
Thank you, Kim. I mean, it really resonated for me when you talked about the issue of isolation. I was telling the panelists before we opened up the conversation that my own family's had to confront that. My mother went to the hospital recently for what she thought was a heart attack, but it ended up being a panic attack. And that was because she's been home alone in St. Louis for 6 weeks. For the first time in her whole life. I mean, she was married to my dad for 45 years. He passed almost a year ago. So even being home alone is a new thing for her in general, but at least she had, prior to the pandemic, the opportunity to meet with friends, to live an active social life that helped with that grief. And that was taken away from her. So we had to make the decision whether my brother, who lives in a low infection area in North Carolina, should drive out to Missouri to be with her. And we made the choice, rightly or wrongly, that we'd rather risk that with him taking lots of precautions than her potentially having more anxiety attacks. And I know, that story is just one of millions that we're confronting in terms of how do we care for our loved ones who are older and are confronting these challenges. And so, Bruce, I'd like to turn it over to you just on the general topic of caregiving, what you've been seeing, what we should be thinking about, and some of the stories that you're hearing that might be applicable to our viewers.
Sure. So a handful of opening comments, and glad to take the conversation in any direction you like. I think we need to look at caregiving in a different way. I want to highlight something that Kim said earlier, which is that we need to look at aging differently, and she's spot on right. And her leadership here in California, as a state that's developing a master plan for aging, is a really good example of that. And I will say, a master plan for aging is not for the aged. It's not for the old people over there. It's for aging because it's something that we're all going to do. And caregiving is sort of the parallel to all that. So, I think as a country and a society, caregiving is something that somebody else generally does over there. And we have a country with a lot of people who are accidental caregivers. And in our own work at the SCAN Foundation, we recently did a poll, this was about a year ago now, that showed that 1/3 of millennials and Gen Xers are caregivers today, and another third expect to be caregivers in the next 5 years. And they may not use caregiving in that wonkalicious capital C policy, sort of public policy frame. They're just helping grandma on the way home. Or they check in on the neighbor that mom and dad normally check on, but when they're working their second job, they'll take that shift responsibility. So it isn't necessarily caregiving. It goes to the important point that I think, Michael, you raised in the beginning is that there's a lot of archetypes about aging that are wrong. So therefore, there's a lot of archetypes about caregiving that are wrong. And, the classic archetype of caregiving is, well, you have this older, vulnerable, frail woman caring for her even more vulnerable, elder, and chronically ill husband it's sort of this silent generation model of what vulnerable old age looks like. And that's just not the world we live in today. There are lots of older people who don't live in a classic nuclear family. There are lots of folks who are trying to make the balance between raising their own family, being employed, growing a career, growing their own lives, and caregiving for family members or friends or neighbors, church members, families of blood and families of choice. And so caregiving is something that we're all going to do. And as a country, we're not really built to respond to that very well. And so I think what the experience we're all seeing with COVID, right, is that it really makes that explicit. So if you have been an economic support for a family member or a friend, and you are now not working and not in a job that's is paying you, and you're still waiting for that money to come to support your family, or the Paycheck Protection Program, you love your job, never expected to be where you were, but haven't seen that money show up yet in your wonderful employer's till so that they can pay you, and you have caregiving responsibilities, that's That's a really unimaginable squeeze. Or the squeeze of raising your own children and having caregiving responsibilities. And I think, Bo, I find your story not unique, but very touching and really important. What does it mean to care for a loved one who is not nearby, but really needs help? And that anxiety disorder, that anxiety panic event that your mother had, it's not an accident. That's a real thing. And it actually puts your mom at risk, not just for having the panic attack itself, but how does she seek healthcare in the safest way possible in a time where you might not want to be in an emergency room? What does it mean for your brother? So these are all really important questions. And I think there's a reckoning about what caregiving means for all of us, since it's going to ultimately be part of all of our lives.
I wonder, Bo, in terms of your mom too. I mean, what happens when it's time to reintroduce her back into her life before all this happened? I mean, how do you ease her back in, assuming that's what's going to happen?
Yeah, I mean, I think that's unknown territory. I mean, right now, I think like many people, we're just looking at the short term. I mean, the difference in her voice when I speak to her on the phone after my brother arrived is day and night. And you're right, Bruce, I mean, that anxiety that she had that led to a very physical panic attack, I mean, she did have very high blood pressure when she went into the hospital. At first, she didn't want to go to the hospital because she was afraid of being infected. My sister, who's a doctor's assistant in Seattle, implored her to go. So she called the ambulance so she wouldn't have to drive because she thought she was having a heart attack. Once she got there, luckily they didn't have many COVID cases at the hospital, so she felt less anxiety about that. But one of the reasons she had high sodium is because she's been eating a lot of curbside pickup food.
Sure.
She doesn't want to go to the grocery store because it's a risk to cook for herself a lot. So she's been ordering a lot of food that's been high in sodium. So I think all of these different variables that add up, thank God my brother can be there for her now, but he's going to have to go back to his wife who has Lyme's disease, who's immune compromised and needs her caregiving, and she's not an older adult. So it's very complex.
Wow.
Anyway, I don't mean to hog up, but I think that these sort of variables are things that everyone's contending with in a lot of different ways. Kim, can you give us some notion as to, how much are people thinking ahead to the reintegration? We're talking about states opening up various layers, but of course, older adults, that might look a lot different for them.
Yeah. So first of all, I want to just say, there aren't easy answers, certainly, and there usually aren't clear right answers either. These are the kinds of things that families are weighing: the risks, the trade-offs, the economic, there's so much in that story. I will say the one thing for sure is people should keep going to the ER. That we're very worried that people are staying home from necessary heart treatment, diabetes, other regular treatments out of that fear. So that was a good decision, and people everywhere should do that. I think the thing I would say is this is not a short term. As you said, everyone kind of made their initial short-term plan, and then you made your second one, right? Like first plan was stay home. Second plan was get my brother out there. And I think we all need to be shifting into the months planning for older adults, with older adults, driven by older adults' wishes and what matters to them. And we're not coming out of this soon, particularly if you're compromised and at risk. And so people should be thinking, and I'll welcome Bruce's comments on this, about that longer term plan. And so one of the areas that we're really focused on. So in our short-term plan, we stood up the Friendship Line California, which is a 24/7 hotline that had previously only served the Bay Area up where I live. We took it statewide last week, so anybody can call 24/7 and get the phone answered and have a chat, or if they're having more of a panic or anxiety, get to the right place, whether it's a suicide counselor or 911, but it just be a chat too. That was our kind of, okay, let's do something right now in April. But honestly, one of the things we're thinking a lot about is the digital divide. I have a colleague at the Capitol who says, oh yes, she has a set of parents and a set of in-laws, and one set has no internet really, doesn't do internet, doesn't do FaceTiming, doesn't do streaming, doesn't do email, and the other does all those things. Telehealth, online grocery. their experience of being home when they have all the digital tools, whether it's for social engagement, delivery services, health, is very different from being home without that, or having the skills or the broadband. So we are thinking a lot about, you're hearing a lot about, and very importantly, very rightly, children who are now home from school. How do we bridge the digital divide so their learning continues? We're thinking just as hard about older adults. What are the devices? There's so much new technology in terms of voice assisted and large screen. You don't have to type. You don't have to go through the whole horrible onboarding that you used to or sometimes do with the laptop. But still, there's support that's needed. Support that's needed to help people get on and stay on board, and then be making that voice call to their kids, or watching their church service in the split screen, or doing their exercise class with Debbie Allen. So we're really, really interested in helping people get there, and frankly, the Hollywood community creating content that keeps them there and that moves them and that provides that sense of emotional connection and service that we really need from the arts and from culture right now, when we're not going to have as much of that face-to-face.
I had I just wanted to run over a couple of quick medical questions with Bruce. One of which was that, they've been calling for older adults. They've been said to be experiencing what they call the twilight of immunity. And I was curious as to how you perceive that and how that's impacting the older adults that you're seeing.
Well, I would say that, the challenge with aging is that we often have less reserve than we did when we were younger. Most
Right.
of the time we're our regular selves. It's just that we have less reserve for the body shocks that we might have had when we were 6 or 16 or 36 or 66 or wherever we are in the age curve. And I would say that immunity is one of those things that varies over time. And so babies are born with very little immunity. What little immunity they have at birth comes from mom. And part of the whole purpose of vaccines, for example, in young children is to help build that immunity against life-threatening illnesses. And as you get towards the end of life, immunity itself is not as strong as it was when you were young. That doesn't mean it can't be made stronger through vaccines. It doesn't mean that older adults can't bounce back. It just means that they have less reserve when they face these challenges. And that's kind of what we're seeing today. It's when you look at who ultimately passes away, it's folks who have lots of chronic conditions. Age is part of it, but age is not the most important driver by far. Mm-hmm. It's chronic illness. And what that tells me, I'm a general internist by training, what that tells me is that it's about narrowing the body's sort of ability to bounce back. You are less flexible to bounce back. The body's a little bit more rigid, has less reserve, and you face challenges much more strongly. And I also really think that's what we're seeing. I think the other real reality here, right, is which hasn't been touched on, but I want to raise, and it really gets at the kind of, it goes back to Bo's question about caregiving and the decision making he had to make in his family, and it really gets to important storytelling questions, right, which is probably something like 70 to 80% of all cases of COVID are in people who are asymptomatic, period. Mm-hmm. We don't even know they've had it. Now, we'll see when we do more testing, as testing comes up, whether it's 50% or 70% or 80%, but it's a very high number. And so, in the process of trying to do well for families and friends, we may have be exposing them and sort of making those decisions about when it's safe and how it's safe. And I think we're going to get to a new normal here, going back to something that Kim said, which I think is profoundly important. The normal we're in now, we're all sort of in it together. Older adults, younger adults, kids, we're all at home, more or less. But we're going to get to a new normal over the next few months where people are going to go back to work. It may look really different, but they're going to go back to work. And kids are going to go back to school at some point. Might be this school year, might not be till the next school year, depends on where you live. But older adults are going to be at home. Let's be clear, until we have meaningful treatments that either make the disease less powerful early on, the way Tamiflu does in the flu, or treatments that prevent the kind of overt immune response, which is what drops people into ICUs and gives them multiple organ damage, or whether we have a vaccine that protects people. Till that stuff exists, or until, frankly, we have herd immunity, which will take a while, older adults are going to be at home. And so their new reality and the new reality of their caregivers and the children of their caregivers are going to look really different. We're going to have two alternate views of reality, which are going to be powerful and create conflict and challenge. So Kim's point about sort of what is the new normal now, but what does the new normal look like in the future is powerfully important in this discussion.
Mm-hmm. But there's an opportunity, I think you alluded to it earlier tonight, you both did, about some really positive developments coming out of this.
Yes.
In terms of how we perceive the way that we, handle older adults in terms of providing care for them, and that whole sort of paradigm shifting to more home-oriented care as opposed to, that dreaded word warehousing and so forth. That this could actually be a positive thing from this.
I think that's definitely true. I mean, I watch, and I realize this is wonkalicious, but it gets down to the life of real people. So, having run large health systems, work with really talented people at the state like Kim and her colleagues, the federal government has offered more flexibilities to the state in the course of about 4 weeks than probably states have seen in the last 10 years. Flexibilities in the Medicaid program, which serves low-income older adults, pregnant women and kids, other uninsured adults, the Medicare program, which predominantly serves older people. Some of those flexibilities are fantastic. So, our work shows that the expansions of telephone visits and video visits has made a huge difference in the lives of older people. And despite real challenges with things like the digital divide, which are real and are far more important in communities of color, poor communities, and otherwise underserved and hard to reach communities, most older adults do fine, thank you very much, with their landline, their not smartphone, or their smartphone. And they're quite glad to talk to their doctors for things over the phone than have to come in person. So Bo, if your mom had a really good primary care provider and had been able to get to that person in real time, maybe we could have made the diagnosis of panic on the phone. Now, maybe not. And Kim's absolutely right that I think people should go to the emergency room if they think they need to. And the fact that your mom was having symptoms that sounded like a heart attack, she did the right thing. But I think the idea, right, that you ought to be able to talk to your doctor. The medical system, and this is a good place for a story, right? The medical system, from my perspective, is completely built for the convenience of those who pay for services, like insurance companies and the government, and those who provide services, doctors like me and hospitals and others. That's not built for the convenience of older people. And so for me, the idea that, well, suddenly we can actually do telephone visits and video visits as part and parcel of day-to-day business, not as some sort of exception to the rule, powerfully important. I think that a really important question about the new normal is, what should the delivery system look like for older adults? How do we start with the presumption that an older adult ought to be able to stay in the community, that their caregivers ought to have an adequate level of support and an adequate level of communication with the healthcare system, and that the home and community-based services that are out there are better linked to support that person's thriving at home? That's a really different model as opposed to saying, well, we built the system because we want to pay for it this way, and we want, and for doctors it's easier this way, and phones are the exception to the rule. Well, now phones are the rule, not the exception. So that's just an example of how things are changing for the good.
Kate, does that indicate to you? I mean, are you seeing or feeling any sort of increasing pressure as a result of all this? Any increasing sentiment for single payer or Medicare for all?
Well, the master plan certainly came out. So Bruce and I met because Governor Newsom said it is time for California to have a master plan for aging. Aging is changing so much. It's not just that there's more of us living longer. It's that what aging is changing completely. And so people are living longer. People are not necessarily married. There's much more diversity in the older California. People are living past their money. There's real financial challenges. There's more dementia as we live longer. So there's all of these things happening, both wonderful and challenging, that are just totally changing aging. And that means that our communities have to change too, and our systems have to change too. So those are exactly the kind of questions that are coming up. I mean, I think one of the biggest ones that Bruce and his team at Scan Foundation were instrumental in is this question of, can we stay at home? And what kind of supports do we need, whether it's nutritious low sodium food or telehealth or community activities that include older people and paratransit. What can we do to stay at home? Now listen, residential facilities are critical. People I love are in them and are well in them, and they will always be part of our system. But I think it's a real question about making sure people have the choices to be where they want to be, meaningful choices they can afford, choices that are safe, choices that feel like home. And so I do think this question of, if you are serious about, we want to make sure that all the money we're spending on healthcare is spent in a way that matches our choices and our values and our well-being, then you do start to look at all those questions about single payer. You look at all those questions about value in the payments and care coordination. I mean, some of us are in managed care and have our care coordinated. Some of us are not. I mean, I think, one of the things that we all, kind of early on we're saying is kind of aging in our country is based on the assumption that you have an adult child who isn't working, who can really take care of things for you,
Yeah.
usually a daughter. And one of the people on our cabinet work group said, oh, that's good, because I have 4 adult daughters, so I'm set. And we kind of all laughed, but it is kind of true that aging in our country is still kind of hoping you have 4 adult daughters who aren't working, who can take care of you. And I think for more and more of us, the daughters, the parents, the never had children, the divorced, the widowed, all kinds of things, that we have to get real about what our communities look like. And that's why, again, the storytelling is so important, to tell the stories of what aging looks like. What are the 30-somethings like now? I see that show's being rebooted. So what does
Right.
look like? And what does 90-something look like? And then how do we then change that? So it's not the senior centers over there or the senior home over there, but it's actually a community that works for you, whether you're 8 or 80, and that you're fully included in. So I think, aging is changing. We hadn't changed fast enough. What this incredible jolt to our system is going to do to change us and propel us into a new future, I don't think we know yet. But again, we're not going back.
Well, I think you wanted to jump in.
Yeah, hi. So I wanted to go back to the two realities for a second, because, Bruce, you rightly say that, as we open up in whatever fashion that looks like, and Kim, you've reinforced this, the reality is that for older Americans, they're going to have to remain at home. However, it creates a conundrum, doesn't it? I mean, my brother, and I'll just keep using my personal examples, is also a 3rd grade school teacher in rural North Carolina. So if his school opens back up, he's going to be with a lot of kids who may be carriers. He'll have to go back to work, assuming, he feels safe enough to. The option to go and drive to my mom's house is now off the table. 1, because he's got to work, and 2, because there's a greater chance that he could infect her. So, you see a potential for actually increased isolation that's going to be more of a problem than it is now, where we might have a few more options. I mean, do either of you have anything to say about that? I mean, as the country opens up, it's going to be harder in some ways to care for our older adults.
So let me hop in and start, and then I'll be very interested in Kim's perspective. I think it's worth asking a question, well, how did we get here? To borrow my favorite line from a Talking Heads song. I think it's important to understand that when Medicare and Medicaid were passed, which are these big programs that help support the healthcare for many Americans, except for those of us who have private insurance. And at the same time, something called Older Americans Act was passed to kind of deal with the needs, particularly of poor older Americans, which gets at things like Meals on Wheels and home and community-based services. That was 1965. Those things were all passed in 1965. And in 1965, the average life expectancy was 69. So the whole idea was you would be on Medicare on average for about 4 years. If you look at the causes of death in 1969, most of them were acute or nearly acute, because there really wasn't much we did for heart attacks or strokes. You either survived them or you didn't. And to Kim's point, people were still fully baked in the idea of the nuclear family with 4 daughters who would do all the caregiving work. And so we are living in a model that was purpose-built for about 1971, and it really hasn't changed much at all, even though the world has changed dramatically around us. And so that gets us to a point where you have all these collection of little programs and things that are there to help people, but for the most part, they never talk to each other. They were never built to. We had hunger, so we created Meals on Wheels to solve a food problem. We needed to cover more people in nursing homes, so we did a few funny things in the Medicaid program. And I think what this calls into question is, well, that's not the world we live in anymore. So what does that future look like? And we're all caregivers. I think what's interesting about the work that Kim's leading for the state around the Master Plan for Aging is in her articulation of it, is it really calls into the question, how do we start with a person and their circle of support, and then bring programs to the fore in a more supportive and integrated way? I also think it gets at public policy questions, which is, if we're all going to be caregivers, for example, while we're working, and we have things like maternity leave or paternity leave, where does caregiving fit in all that? And what does an employed workforce look like going forward? And this is not meant to be a handout to working people. This is a reality that we have a new way of working, where you have lots of single head of families. You have families which may have 2 parents, but people both have jobs and may have more than one job. So how do we create an environment that people work, raise their children, and serve as caregivers within their family of choice or blood? These are really, really powerful questions. And just, you're our archetype for this discussion, right? So your brother's wife is at increased risk. So as he goes back to school, let's assume he goes back to school, kids are likely to do, for the most part, to get sick and do fine, assuming that they aren't ill. But this creates increased risk for your brother and his wife. So how do they manage that? If your mom doesn't have a lot of other choices, how does your brother navigate those waters? Are there programs that could help? Does he still go but leave? So I have an 85-year-old, I'll do my story. I have an 85-year-old father who lives in a very tiny community on a cliff that overlooks the edge of the Pacific Ocean here in Southern California. And it's like 12 beach shacks, all crazy ex-hippies for the most part. And there's no food there's nothing, there's no services for 15 miles. So every week, whatever Amazon can't drop on his doorstep, and Grubhub and Postmates, they ain't going there. That just is not happening. And so I literally, get the grocery order, and it's a little bit like a scavenger hunt, because it's like, I want 2 zucchinis and blueberries. I'm like, well, we'll see if they have them. So I think all of us are going to find, and I'm sure many of our listeners are balancing those questions. How close can I get to my dad? What is safe? I certainly can't hug him. And I actually think human connection is really, really important. So when you look at the images we just see on television of, spouses face-to-face with spouses in nursing homes, right? Where I can't touch you, but I can at least we can be face-to-face through the window. Or the awful challenges of having to say goodbye to somebody who is, on death's door in an ICU. What happens when your brother goes back to work? What does his reimagined caregiving life looks like? What does that mean for him? What does it mean for his mom? How does that circle get squared? And the answer is it won't be squared perfectly. And there'll be risks on both sides for how that circle gets squared.
We're thinking about a lot of pieces of this. Let me just do a few. First and foremost is purpose. We all have to have a sense of purpose, whether it's our work, our family, our volunteering, our hobbies, our mission. And how do we find this new purpose if we're home, if we're in a residential room, in our room for months and months and months. What is the call to action, the call to service, the sacrifice? You know, America and all cultures have histories of rallying and sacrifice. So we're thinking a lot about, it's not just staying home, it's also going to, it's answering a call and making sure that we frame that purpose so people know why you're staying home. And it's for, it's not just a medical, you know, CDC told you to, it is for a larger purpose. So that's something we're thinking about, which I only kind of lead with that in this room of people who value words and meaning so much. A second piece is this community services. Now, we've mentioned, you know, everyone's now doing their things online. Well, what happens when half of us don't anymore? And our colleagues and our allies who are disabled say, you know, we've said for years the service and the meeting could be broadcast. We've said for years you could telework and telehealth. And so what I'm wondering is when not all of us are here, will we remember that we can? And will we figure out ways to do the dual of people who are congregating and people who are not? And so that we, again, reinvent for those different, as our governor says, the dimmer of on off of how congregating we are and how isolating, physically isolating we are, so that we make sure that our community events, I mean, I was talking to the chief librarian of the state this week. What are libraries gonna do? What book delivery, what e-reader delivery, what reading books on the phone, call-in reading, what are all the different ways you're gonna push culture out and continue to do so? The biggest customers and volunteers at libraries are older Californians. So how are you gonna reinvent, you know, they're getting public health guidance that books don't carry the COVID if it's paper. You know, we're working through what does a library look like as a community engagement source over the next weeks and months. A third area, behavioral health, can't say it enough. It's just there's gonna be loneliness, there's gonna be anxiety. And so yes, it's the friendship line. I think we put in the chat, it's also telehealth, thinking at, you know, older specific, targeted to that generation and those multiple generations, I should say, who are staying at home. A fourth piece though, is these services. We're having a lot of discussions about when can services come back and what would that look like? When could a home healthcare worker get in and what type of equipment, you know, personal equipment, training would be needed so that that person could come in, whether it's to clean the house or do some daily activities. We're gonna have to figure that out. Again, it's not gonna be off on, but how do we bring back smart some services? And I would be remiss if I didn't mention income. Right, older Californians are working and now aren't going to work or work in the same way. I mean, some of them can telework, some of them can't. The stock market losses, you know, later in your life, later in your career, harder to recover from. So are our income supports, are our stimulus really going to benefit people who are 60, 70, 80, and 90 who still need income? How do they recover from the income loss? So there's just a lot of pieces to this that we're trying to imagine what it would look like. And I will say there's I try not to get too glass half or more empty, because there are also opportunities for libraries to be better than ever, for our community activities to be more inclusive and across the lifespan. I mean, I'm so excited that gerontology students are making phone calls to older Californians. Again, this is all of us together. And so there are chances where we do run the risk of segregating by age because of this. And we also have the opportunity to come together in new and different ways. So that's really on us.
So I really want to build on Kim's purpose point for a second, because I think it's sort of critical. It brings it down to the person. And I actually think it's potentially the basis for good storytelling, because I think that's a spot on point. So, you know, I would just, as a parenthetical throwaway off point for a sec, I just want to say, you know, we ought to be thinking about caregivers as a form of first responder, and they're really not referred to that way, but they are the last mile for a lot of older adults who actually may not be that frail or vulnerable or whatever the case may be, except for one thing. Like, if my thing is transportation because I just can't drive because my vision's bad, I had my cataracts replaced, and I'm not comfortable driving. I mean, I'm otherwise okay, but I just can't drive. But that disappears for me, either because I feel it's unsafe or my source of driving support went away. So I just want to sort of raise that parking lot up for a second if we want to come back to it. But I think, you know, as we think about it in the foundation, there are these three things that really need to happen, and they need to happen now, because when we get to these two alternate realities of new normal, when the gulf starts to widen between those two new normals, there'll be an issue. So one, going to this purpose point, for every older adult, just the really basic thing, like older adults, when they get lonely and depressed, just tend to, their sleep cycles are off. They don't do anything. They sit in front of the television and watch, endless cycles of breaking news that are not really breaking, regardless of what flavor of news they like to watch. So talking with older adults about what's your plan for the day, and actually having a plan for the day. You're going to get up at a certain time. You're going to have breakfast. If you can get out, if you can walk, what does that look like? So you start to go back to having a plan for the day. That you're not sleeping all afternoon and then up all night listening to talk shows, that kind of stuff. So that's an important step. Another really important step is for older adults to really think actively about who their circle of support is and be part of the circle of support of others. So one of the things I'm really struck by is the number of older adults who are suddenly calling friends that they haven't called in a really long time just to see how they're doing. And I would just bet in all your lives, people who you haven't seen or heard from for a while have picked up the phone to say, how's it going? Bo, how's your brother doing out there? And what's up with your mom? And so I think, sort of right now that stuff is pretty much accidental, versus if you were to turn to an older adult and say, who is in your circle of support and how are you reaching out to them? So like if your grandkids are part of your circle of support, you should be scheduling a call maybe for 30 minutes with them once or twice a week. And maybe they get to pick the topic. Help me with my homework. I want to tell you what I did in school. But it's proactive, not reactive. And I think older adults can really play a part in their world, even if they pick 2 or 3 older adults who are in their neighborhood, go to their church, whatever their connectivity is. That they reach out to, that actually builds a circle of support. And then that gets to the third issue, which is, I think, having a plan, like being, so you take those 2 pieces and you build a plan for like, what is it I'm going to do in this new world? That actually arms the older adult with a sense of purpose and a sense of resiliency. And actually, I think it helps caregivers feel better that there is a plan, that mom or dad is acting on a plan, that there are others in it. And then actually when the plan deviates for some reason, like mom didn't call the neighbor she usually calls, or she said she would call, my son or daughter while I was at work and that didn't happen. Like those are clues that something's off. So I think we can't just expect this to happen by accident, and it shouldn't purely be reactive. And that can lead to stories of success.
Yeah.
So we're flying through this hour.
Yeah.
We tend to go a little bit over, so we'll go for an extra 10 or 15 minutes or so. But we've had a lot of questions come in, and I want to make sure we get to some of them. Michael, do you want to start making your way? Maybe we can leapfrog between the questions here.
Yeah. Well, let's see. Here's a question rather from Stephen. He said, "Do you feel that the media is underreporting the effect of all this on people with disabilities?" He says, "Not even CNN to date has mentioned even the word disabled during their coverage. Don't we need that data in addition to the elderly and underserved ethnicities?"
Yes.
Yes, and I mean, disability is a huge, diverse category, and not every disability puts you at risk, higher risk for COVID by far. And so one of the fascinating conversations, actually my next call when I finish with you all is with all the aging and disability leadership to talk about this, because we're talking about, again, while there's risks that are physical and health-based, and Bruce said it well, the chronic conditions, the age, some of which are very much tied to disability, there's also these setting risks that if you are in certain settings, like either you have a home healthcare worker who's visiting lots of people, or you are in a residential setting that puts you at risk. And yes, people with disabilities and older adults are in those more sensitive settings. So I think part of it is we're not that great about talking about aging or disability. We're not that great about talking about it accurately. So there is more to do to, and I would urge, the risk of being cliche, I hope you all have heard the classic mantra of the disability community, which is nothing about us without us. And we've been really, that community has really risen up to say, A, we need to be part of this conversation more, and B, we need to be at the table. as we tell these stories about what it's like to be a person with disability sheltering at home, whether that's a hearing or a vision or a physical or a mental health or a chronic condition. I mean, there's, again, the diversity there is extraordinary. But that's right, there's more attention and more stories to be told.
I think we just need a more diverse, a more robust and diverse set of stories. You know, right now the news is still so stuck on the number of cases and the number of deaths. And I think we need to move beyond this. And I actually do think this is where the storytelling that many of the folks on the call can help with, which is I think we need to tell a more diverse set of stories about a more diverse set of experiences. And you know, in some way, entertainment may actually lead how we think about this discussion as opposed to waiting for I realize it's a very long cycle time from story to production to
well, it's interesting. It's interesting you say that, because I saw an article yesterday or the day before that was making the point that the coronavirus is now starting, it's taken a while, but it's now starting to show up in comic strips. That the nation's comic strips are starting to respond to this because they have a certain amount of lead time. And the same thing is true with the kind of shows that Bo makes, the episodic television shows and drama and comedy. And it sounds like what you're talking about are the kind of stories you'd like to see them developing and telling.
Yeah, because I think there will be the humanistic, you know, the problem with what's being reported now is it's just numbers at the top, right? You know, it's like it's like counting the white tombstones at a military cemetery, and while that's a dramatic image, it's not really a story in and of itself.
Right.
And I think, you know, moving to a more diverse set of stories that really talk about human experiences, and I think this notion of the sort of caregiver, care receiver dyad is really important, because the shoe may be on the other, you know, the shoes can go back and forth from one foot to another. So it may be that the older care receiver is actually helping support a family where suddenly somebody's unemployed, and that, you know, there has been no, you know, check that's arrived to help try to fill that balance. So there's a really nuanced set of stories that gets at culture, that gets at, you know, ability and disability, that gets at location. And I just think that telling those stories powerfully can change the way we think about what's happening, particularly as we get to these multiple realities where some people are home more than are working and whatnot.
I think that's really, I was just going to say, I think it's really interesting to think about, you know, older adults as sometimes being the caregivers for younger adults.
Absolutely.
Grandparents.
Well, you know, there was a time in Hollywood when a lot of the movies that had the sort of classic American family, like Meet Me in St. Louis, for example, the grandfather was part of the family, you know, and the grandfather was an integral part of the family dynamic and helping the family along. And you used to see that a lot in all kinds of films from Hollywood in the 30s and 40s.
Kim, I'm sorry to interrupt you there. I want to give you a chance to weigh in on this, but the questions are pouring in. I want to make sure that we get through as many of them as possible. So be mindful in your responses. Try to be as potent and brief as you can so we can get as many.
I'm glad it's back.
Kim, you were saying before I move on to the next question?
Well, this is a pretty heavy point, but one of the cultural tears that we're going to have and are having is around death and grief rituals and funeral convenings that people are not able to do. And I've been talking to tribal leaders about how you process that. So I will just leave that as a big and heavy and important topic, is how are we as families, as communities, going to process grief when all the narratives that we've had our whole lives are not there for us? And so I think grief is something we've got to wrestle with to help with the trauma.
So we have a question from, I'm going to do this one by Stephen Tingus. He starts with a compliment. He says, as the former presidential HHS Deputy Assistant Secretary for Disability, Aging, and Long-Term Care Policy, that's a big business card. This roundtable was and continues to be exceptional and should be massively publicized on social media platforms. Major congrats, Kate Falb and HHNS and the USC Annenberg Norman Lear Center, and I'll add the WGA. So that's nice to hear from someone who knows. Stephen asked if the continuance of the pandemic as expected Sorry, sometimes I have to work through a little bit of grammar stuff. Shouldn't we have a gubernatorial executive order to mandate telemedicine by all physicians for seniors and disabled? Both communities are in high-risk groups. Early detection without possibly acquiring concomitant condition in an ER at this moment could reduce the burden on the nursing demand. So to use a Bruce word, which is now my new favorite word, that's a kind of a wonkalicious question.
Right.
Can you rephrase it for the layperson and give us a potent and brief response?
Go ahead.
Bruce.
Let me start and then Kim can weigh in. So,
No,
you
you
know,
got
I think that there's been enormous, more flexibility, I think, has been granted to states than they actually know what to do with at this point, more than they can probably actually digest and use. And I think that states are actually making the most. In California, I mean, we're very lucky in California that I think it's been very well leveraged here. And I think it's been very well leveraged in New York and some of the other places that are really on the sort of tip of the spear of the outbreak. And so I'm really, I'll be honest, I'm really proud of my state, and I'd be the first to speak up if I had tons of concerns. I think before we ask the governor to do a bunch more executive orders, I think we need to look to the state to put to work the opportunities that exist. But then I also think, and it's part of why a master plan for aging and the work that Kim's leading is so important, is we need to really, so when I look at all the flexibilities, they fit in 3 boxes. Those that should be kept in the bell should never be unrung. And I think they'll be very hard to unring. So I think we will see telehealth and whether it's phone or video visits here to stay. I think the question is, how do we do that in a way that's appropriate so that, because there's still times, I mean, let's go back to your mom, Bo. I might be right that she could have had this, a really good PCP might have been able to recognize that as a panic attack and talk her off the cliff. Maybe not. Maybe the ER was the right place. But I think the idea that there will still be a need for face-to-face encounters, and we need to make sure that folks can get to them, is really important. So what should stay? And not be changed, like we should just hit the gas pedal. What needs to stay but really does need to be reshaped or moderated in some fashion? And which things have been granted that actually are bad and should go away? And let me give you one that I think is grist for a story. So one of the flexibilities that has been granted by the federal government to states is right now, if you're admitted to a nursing home, a doctor needs to go have a face-to-face visit and put a plan of care on that person's chart within 3 days. And there are flexibilities that now allow that to go to 30 days. I think it's completely unethical and not appropriate for somebody to sit in a nursing home for 30 days and not be seen by a doctor. It's a medical environment. I understand the need for more flexibility right this very moment and letting the states figure out, and that flexibility was meant, you know, pardon my French, but it is now 6 o'clock. It's 6 o'clock here. You know, if all hell breaks loose, that flexibility is important for the states. And, you know, is there something magical about 3 days versus 2 days versus 5 days? I don't really know. So I think letting states do what they need to do to preserve life and take care of people makes total sense. Would I like to see that rule be in place a year from now? No. So I just think rather than ask for an executive order, I think asking for a really rational plan. I mean, we're seeing more change in the healthcare delivery system in 2 or 3 months than we would see in a 10-year period. So I think a rational plan for what we keep, what we reshape, and what we get rid of is really the challenge we should be asking for from state leadership. It's kind of yeah.
We've had a couple of questions from people watching about dementia, actually, and I just wanted to put some of that forward. One person saying, you know, what do you think the long-term care facilities who were hit hard will need to do to bounce back? Somebody within her family dealing with both COVID and dementia. Another person saying, I've seen my stepfather with moderate dementia really decline over the past 2 months due to the decreased stimulation. And I know this is an issue I've been reading about. There's only my mother who he lives with and myself who lives nearby. I'm a healthcare provider, so I need to be careful and limit exposure. I've been able to work from home for now, so I can still help. My mother's medically fragile, but still completely with it. Any thoughts or ideas?
Well, and let me just add to that, yet another question on the same topic. how can we best serve residents in senior facilities? My mother's in a Jewish home with Alzheimer's, and I know they are lacking stimulation or kept isolated because of the current situation. How can we help when many facilities do not have the infrastructure to support virtual stimulation?
Yeah. Yeah, there's no question that people with Alzheimer's and their family and friends and caregivers are among the absolute toughest. The disruption in the routine, the difficulty sometimes in maintaining their own personal distancing and hand washing and not touching is very, very, very challenging. Understanding why people aren't visiting, it is incredibly, incredibly challenging. All I can say is, we are partnering deeply with the Alzheimer's Association. They have one of the best 24/7 hotlines with all kinds of resources. You've got to call them anytime, day or night. I'd also say we're extremely lucky in California with Maria Shriver chairing the governor's task force on Alzheimer's preparedness and prevention. She has been a leader all over this space. Even before this, and even more so in the COVID response, she has been leading Facebook and various conversations with families who are asking all these questions. And I wish there were better answers. I don't know, Bruce, if you have them, but mostly it's listening and support and helping people try to rally all their resources, their family and friends. But it is extremely, extremely tough.
Yeah, I think that's right. I mean, I guess what I would just add to what Kim said is just to recognize that, social isolation is a social determinant of health, just like education, economics. And, there's a study out there that equates social isolation to like smoking, I forget what it is, like a dozen or 15 cigarettes a day. But the point here is that it is toxic, and it decreases people's functional level and reserve in ways that they may never regain. And so it's a really valid concern. And for dementia patients, it's even more of a concern because it's harder for them to regain that function after they've lost it. So preserving function is the most important thing you can do. I do think in these times, trying to find ways that work for individuals to keep them in contact with people is all that we can do given the level of social, because we have listeners who are all across the country with states that have all different rules about how much social isolation or contact they can have. And I think just trying to figure out how you get as much meaningful contact in front of somebody in a skilled facility is the best that we can do. And whether that's video contacts or telephone calls or face-to-face visits through windows, I think it's ultimately going to come down to sort of facility by facility and state by state. But to me, regular contact with people and information that tries to preserve the world of a demented older adult is the best we can do. And there is no simple answer.
I think also, go ahead, Kate, I'm sorry.
One bit of hope, and I think that sometimes these challenges are very heavy, but they also call out amazing creativity. I just saw a video yesterday of a young man whose grandmother had dementia and was really, really missing her shopping trip, her routine of going out and going to Costco and the errands. So they brought it home. They set up a whole Costco for her in the house and took her shopping, and she was delighted. And so I think that kind of creativity, well, that's not a placebo to solve everything. We are called to be creative in new ways together.
While we're at it, who takes care of the caregivers? I mean, there's just so much stress that they're putting up with, and anxiety and fear. I know that this covers from the front line in the hospitals all the way through to the people working out of homes with parents or other loved ones. I know I was at the Landstuhl military hospital in Germany a few years ago, where they have this incredible problem with what they call, secondary traumatic stress, which is the staff. I mean, the medical people, the people, again, on the front lines who have to put up with this enormous amount of trauma. And I worry about that with all the caregivers.
Yeah, we are doing a webinar with Alzheimer's Association on a series of topics, and one of them is this, self-care, next Wednesday. I would also say we're so lucky in California with our Surgeon General, Dr. Nadine Burke-Harris, who is just the leader in really going out there and talking about stress and anxiety and mental health, and how we have to exercise, nutrition, have human connection, meditation. I mean, that may sound California to some folks here, but there is science about how all of that. So in some ways, it's a chance to bring that forward. Actually, one of the webinars we're having this week is COVID conversations, essential conversations, things that may have been taboo. we don't have time to waste. We have to talk about these things. We have to talk about being lonely and anxious. We have to talk about death. We have to talk about our wishes. So I do think that's, again, not to be Pollyanna, but there is a silver lining in drawing deeper together, even as we're staying apart.
So we're quickly approaching the time where we're running out of time, and we have a handful of questions left. So this is the speed round. And I'm going to read through them really quickly, and then you can choose whether you want to answer all or some, but keep it brief. And then I'm going to finish, if Michael doesn't have anything else, with we mentioned something about breaking stereotypes, which is something that Hollywood Health and Society does such an exceptional job at, and I think it's a good place for us to end after we get through these handful of questions. If there's any big headline stereotypes about older adults that we should be avoiding altogether. So really quickly here, we have a nice compliment to you, Kim. I'm a 66-year-old man living and working with a disability, and I truly appreciate Kim's comments regarding disability and quoting nothing about us without us. So well done on that front. Okay, a few quick questions. One is, I do not hear anything about the cost of in-home care. Many people can't afford in-home care, which is not covered by insurance. Is there any talk of including something about this issue in the conversation, or I might add in stimulus or policy? What's the 30-second answer to that?
Well, the short answer is that a number of states have started to think about this. Washington State, for example, just actually passed a piece of legislation that creates a long-term care insurance program in that state. The Master Plan for Aging Work in California had a subgroup that needed to make direct recommendations to the governor. One of their recommendations was to explore that. Our state has done some exploratory work in the past at a legislative level. I think the reality is that we've been talking predominantly about family caregivers who are not paid. They're doing it as part of just being family of blood or choice. But I think the reality is, with an aging society, we're going to need to look more at how we help pay for those services when we have needs that are greater than a family can provide, or where there aren't family members to do it. So I'll stop there.
Great. Someone asked if we could provide resources for caring for aged parents. All the resources that have been mentioned are in the chat section, will also be made available on the website. So that's the answer to that question. Last question before we move to stereotypes. Thank you for the insightful session. What models from other states or countries that can we look towards for ideas and examples in bridging and expected worsening of age segregation post-lockdown? I think we've addressed this a little bit, but are there any specific places where you see a good job being done?
Yeah, I mean, it doesn't have to be, sometimes you used to hear the word age tsunami. It's not an age tsunami. It is a golden age for the Golden State and for our country. And so it can be this wonderful reinvention and opportunity. The single family home doesn't work for a whole lot of people. You see all kinds of creative housing coming out of this in communities where there's fewer kids and more older adults. I love examples in France and Japan where they have aging civilizations, and the mail carrier is now also can check in, and you can book the mail carrier to stop for a cup of coffee or do a wellness check. I mean, there's all kinds of ways you can just reimagine parks. Who are the parks for? Are the parks only for people who can swing with monkey bars and even my kids break their wrist? Or are they for all of us to get out there and do physical fitness? So there's just a ton of examples around the world and around the country of a very bright future.
Michael, do you have anything else?
No, I was just going to wrap after we finish the stereotype question. If you want to go to that, then I'll wrap. Is that okay?
It's good by me.
Yeah.
What are the stereotypes that our writers need to be, avoiding? And are there any things about the older adult population that we should be reinforcing?
A couple things, I guess I would say. So the first is, I'm picking right up where Kim started. Please, 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 if we only plant one thing in your head. My goal in life now is to banish the phrase silver tsunami, which is everywhere. I mean, let's be clear about what tsunamis are. Tsunamis are unplanned natural disasters. Growing old is not a natural disaster, nor is this a one-time silver tsunami thing. This is not the snake that swallowed the elephant, and once it comes out the other side, we're all good and we can go about our business. If you look at the sort of, now I'm going to be wonkalicious again, when you look at the demographic pyramid in the United States, it doesn't turn back into the way it looked in 1950. Actually, the demography for Gen Xers and millennials looks exactly like the boomers. The number of people may be different, but the age cohorts look exactly the same. So what that means is we're building for the next 50 years. We're building for the future for the next 3 generations at least. And so this is not a problem that's over there. And then the last thing I would say is the sort of sick, poor, and alone version of old people is wrong. It is an archetype of vulnerable aging, but it is not the only archetype. The older person who you see out there is you 20 years from now or 30 years from now. It's this person who has kind of the same wants and needs, has the same wants, but maybe a slightly different way of solving them or going about them because of their physical limitations. So I'll stop there.
Yeah, and I would say, first of all, no one likes the word senior anymore, so thank you for banishing that word and helping us figure out the new language. We have a different word for like the first 10s, 20s, 30s. We got different words for all that. And then we get to 60 and we run out of language. And so we say senior for everybody for the next half of your life. My colleagues run the First 5 Association, which is for the first 5 years. And I say we're running the last 50 and we have no language for the last 50. Are we older? Are we elders? So I think just that, could we talk about how 60 is nothing like 80 and how 60 is a whole lot of different things if you're working or retired or caregiving. So I think it's just the telling of the more stories, the not falling back on the cliche. And then I guess I have to say to Hollywood, if you privilege physical, then aging is going to always be negative, right? But if you privilege wisdom and compassion and experience and purpose and all that makes us human, then there's nothing magic about 21. Some of us may never want to go back to 21. So I think it's also that, you know, just embracing all of our humanness and allowing every decade to be your best decade.
Great. That's so terrific. I just want to, I'm going to throw it back to Kate here at the end, but I want to just thank everybody from Hollywood Health and Society, including Kate and Leica and Melissa, and everybody else who's worked on this, and our friends at the Writers Guilds of America East and West, and my friend Bo. And as mentioned at the top, you'll be able to watch this again if you want to see it again or tell your friends about it. It'll be on the YouTube channel and on our various websites and so forth. And we're going to do this again a week from tonight, and the topic's going to be criminal justice in the age of coronavirus. So over to you, Kate.
Great. Well, thank you, everybody. Thank you, Michael and Bo and Kim and Bruce. This was a fabulous discussion. Thank you so much. Quick note. We also have, for those who are looking for resources and information, we also have tip sheets on a variety of topics around older adults and aging that you can find on the Hollywood Health and Society website. And I'll just leave you with, there will be a survey popping up when you leave this gathering. So if you would fill out the survey and let us know what you thought of our discussion, that would be great. Thank you, everyone. Stay healthy, stay safe. And we'll see you next week when we talk about criminal justice.